Hi there. Now here in the UK where I'm based, there's lots of talk on the news about children catching Strep A, which is an infection. And I just want to be able to address what that actually is and the signs and symptoms we can look out for. So don't forget to watch the video all the way through to the end so you don't miss out on any important information. And if possible, can you hit the subscribe button below so you can watch all our videos as and when I release them. Okay then, first of all then, what is strep? So strep is called a streptococcal infection. Now these infections are caused by several strains of bacteria, and the most common tend to be strep A and strep B. And these infections are extremely common and are actually frequently responsible for sore throats experienced by millions of us every year. Now the most common group is strep A. And that's a bacteria which has caused relatively mild skin and throat infections, and they're responsible for conditions such as sore throat or strep throat, impetigo, which is a localized infection of the skin and producing kind of pus-filled blisters, cellulitis, which is the infection of the skin and fat and underlying tissues, tonsillitis, which is a very severe throat infection which particularly impacts the tonsils. I've definitely had that myself when I was younger. And scarlet fever, which is an infection causing sore throats, fever and rash. Now these infections are common and they usually do resolve themselves quickly with antibiotics. It is very rare for these infections to cause serious illness. But if you or your child present with one of these infections, do contact your GP and get treatment early. It is not always necessary to go to A&E. However, streptococcal bacteria can get into the blood, the deep muscles or the fat tissue, and can cause what we know as invasive streptococcal infections. And these can be extremely serious and life-threatening, and they are responsible for some of the following conditions. Endocarditis, which is the lining of the heart having an infection. Meningitis, which is the brain and spinal cord inflammation. Peritonitis, which is the intestines getting inflamed. UTIs. Streptococcal toxic shock syndrome, which is infection causing low blood pressure and injury to organs such as the kidneys, the liver and the lungs. Very similar to something we know as sepsis. Well, how is it passed on then? How do people catch it? Well, streptococcal bacteria are spread by person-to-person contact with someone with an infection. And streptococcal bacteria can also be spread in droplets from our nose or our throat of someone with the infection. Now, rarely streptococcal bacteria can enter the body in food contaminated with the bacteria, things like milk products and eggs, but that's quite rare. And invasive streptococcal infections develop when bacteria gets past the body's natural defences, such as a break in the skin, a cut. Health conditions that reduce immunity to infection make invasive infections more likely. So people with chronic illnesses like cancer, diabetes, kidney disease, and those who use medications such as steroids, well, they're at greater risk. However, invasive streptococcal infections can be a complication of other streptococcal conditions, such as things like scarlet fever. And so parents should be very vigilant for early signs that the child might be getting worse or becoming seriously ill. So what can we do to prevent the spread of it? The spread of bacteria can be reduced by good hand washing, especially after coughing and sneezing, and before preparing foods and also before eating. Cuts, grazes and other wounds should also be kept nice and clean and be looked at for signs of infection, which could be things like swelling, redness, pus and also pain in the area of the wound. Now if you see any of these signs, you should visit your GP. Now, if you do see the GP, the streptococcal infections are actually diagnosed by testing a swab from the throat or by the blood or urine test. And infections are treated simply with antibiotics. Invasive streptococcal infections usually require intravenous antibiotics given directly into the vein. The patient will therefore need to be admitted to hospital and may require intensive care. But invasive infections that affect soft tissues, bones or muscles may actually require surgery. And early treatment improves the outlook greatly, but some invasive streptococcal infections and some group B streptococcal infections can be fatal. All strains of streptococcal bacteria can cause complications which can infect the heart and the joints, the kidneys, and sometimes public health will advise that all close contacts with the streptococcal infections are given antibiotics just as a precaution. Strep A infections is also responsible for things like scarlet fever, and there has been a recent surge in cases of this infection post-pandemic. So recognising if your child might have a streptococcal infection is really important. But there are a lot of viruses that can cause sore throats, colds and coughs currently circulating here where I am in the UK. These should resolve without medical intervention. However, children can on occasion develop a bacterial infection on top of a virus that can make them more unwell. And as a parent or someone that looks after young children, if you feel that your child seems seriously unwell, you should trust your own judgment. And here in the UK, you'll contact the NHS 111 or your own GP if your child is getting worse. If your child is feeding or eating much less than they normally do. If your child is not drinking or not passing much urine. If the baby is under 3 months and has a temperature of over 38 degrees Celsius, that is, or is older than 3 months and has a temperature of 39 degrees and above. Or if your baby feels hotter than usual when you touch their back or chest, or feels quite sweaty. Or if your child is very tired or irritable, more than normal. Now you must call the emergency medical service or go straight to A&E if your child is having difficulty in breathing. You may notice the grunting noises of their tummy, sucking underneath their ribs. There are also pauses when your child breathes. Or your child's skin and tongue or lips are very blue. Or if your child is floppy and will not wake up or stay awake. Or if your child isn't drinking and hasn't had a wee or wet nappy in the last 12 hours, because that's unusual, isn't it? Or they have mottled skin and the limbs are abnormally cold. You must make sure you go to A&E then. So the symptoms of strep bacteria can cause a wide range of infections, and each infection produces different symptoms. Symptoms of the most common streptococcal infection are strep throat, a sore red throat, fever, headaches, swollen lymph nodes, these ones here in the neck and under the jaw. It's really important to make sure you've got good hygiene with your hands. During the pandemic, we practiced washing our hands, singing happy birthday. Keep encouraging them to do that. Make sure they keep them away from others as well if someone's feeling unwell. They'll be able to reduce the risk of picking up or spreading infections by doing this. Thanks for listening, guys. Let me know if you want me to cover any topics. Next week, we're going to be releasing the one about scarlet fever, so you can look at the signs and symptoms for that. But hit the subscribe button so you don't miss out.